Oxazepam is an intermediate-acting benzodiazepine with slow onset commonly used to treat panic disorders, severe anxiety, alcohol withdrawals, and insomnia. In this video, let's found. What is oxazepam? What is oxazepam used for? Contraindication. What are the side effects of taking oxazepam? How does oxazepam work? How to use oxazepam? What is oxazepam? Oxazepam is a short to intermediate-acting benzodiazepine. Oxazepam is used for the treatment of anxiety and insomnia and in the control of symptoms of alcohol withdrawal syndrome. It was patented in 1962 and approved for medical use in 1964. What is oxazepam used for? Oxazepam is indicated for the management of anxiety disorders and for the short-term relief of symptoms of anxiety. It may also be used in the management of alcohol withdrawal symptoms. Contraindication. Oxazepam is contraindicated in myasthenia gravis, chronic obstructive pulmonary disease, and limited pulmonary reserve, as well as severe hepatic disease. Side effects. The side effects of oxazepam are similar to those of other benzodiazepines, and may include dizziness, drowsiness, headache, memory impairment, paradoxical excitement, and anterograde amnesia, but does not affect transient global amnesia. Side effects due to rapid decrease in dose or abrupt withdrawal from oxazepam may include abdominal and muscle cramps, convulsions, depression, inability to fall asleep or stay asleep, sweating, tremors, or vomiting. Pharmacodynamic. Benzodiazepines, including oxazepam, exert their sedative and anxiolytic effects by potentiating the effects of endogenous GABA, the primary inhibitory neurotransmitter in the CNS. Compared to other benzodiazepines, it has relatively low potency and a moderate duration of action. Oxazepam should be administered with caution to patients for whom a drop in blood pressure may lead to cardiac complications as, in rare cases, it may cause hypotension. Mechanism of action. Like other benzodiazepines, oxazepam exerts its anxiolytic effects by potentiating the effect of gamma-aminobutyric acid, GABA, on GABA-A receptors, the main inhibitory neurotransmitter receptors in the mammalian brain. GABA-A receptors are a kind of GABA-gated ionotropic chloride channels that produce inhibitory postsynaptic potentials following activation by GABA. The channel undergoes a conformational change that allows the passage of chloride ions through the channel. The inhibitory potentials produced by GABA neurotransmission play an integral role in the suppression and control of epileptic nerve firing, such as that seen in epilepsy, which makes the GABA system a desirable target in the treatment of epilepsy. Benzodiazepines are positive allosteric modulators of GABA-A function. They bind to the interface between alpha symbol, and gamma subunits on the receptor, commonly referred to as the benzodiazepine binding site, and modulate the receptor such that its inhibitory response to GABA binding is dramatically increased. Half-life. The mean elimination half-life of oxazepam is 8.2 hours. Dose. Anxiety. Mild/moderate, 10 to 15 mg, PO, Q6-8HR, PRN. Severe agitation or association with depression, 15 to 30 mg, PO, Q6-8HR, PRN. Alcohol withdrawal. 15 to 30 mg, PO, Q6-8HR, PRN. Safety advice. Advice and warnings for the use of oxazepam, Cerex, during pregnancy. FDA Pregnancy Category N, not classified. That's all the information about oxazepam we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.